One of the things I like to address early on in my clinic visits with my onco-nephrology patients is to first try to address the common misconceptions of, I've been referred to see a kidney doctor, he must be going to start me on dialysis. Now the truth is, it's only when the kidneys have zero kidney function or very, very diminished kidney function do they need dialysis. And so sometimes I forget to bring that up in a clinic visit because it's the least of my concerns. But I know that sometimes I'm talking to patients where they're on edge and just want me to bring up the D word, dialysis. And the truth is, by referring patients to me very early, we are very seldom talking about dialysis on that first visit, or certainly if ever. But the vast majority of patients, we're just trying to set right so they can continue their treatment. And by and large, more likely than not, we'll be discussing what has caused a small, moderate degree of kidney injury that we need to sort out. Sorting that problem out certainly long before we ever are forced to have a conversation about dialysis. How to keep an injured kidney going can manifest in different ways. Sometimes that means increasing your fluid intake or even increasing your sodium intake to make sure that you're well hydrated or your blood volume is restored. Just trying to offset any of the GI distress that can leave some of our patients quite weak. Simply, a lot of the times it's simply just tweaking some doses of medications. But for the most part, we can get a good idea of what's going on in your kidney just by routine blood work, urinalysis, and even looking at your urine underneath the microscope, which we do at the time of our first visit. That urinalysis is kind of a poor man's kidney biopsy, and we can get a lot of good information by looking what's going on in your urine sediment as a surrogate for what's going on inside the kidneys themselves.